on.
Dispatch. You are dispatched to the university baseball field for an injured player. Upon arrival, you are escorted to the dugout where a player is sitting up, complaining of chest pain and shortness of breath. He was in the batter's box when he was struck in the left side of the chest with a 90-mile-an-hour fastball.
Scene safe?
Scene is safe.
His standard precautions have been taken. How many patients do I have?
One patient.
One patient. As I approach the patient, I gather a general impression. 22-year-old male patient has been hit in the chest with a baseball, sitting up, holding his chest. Possible chest injury. It's definitely a trauma call. How many? This is the only patient?
The only patient.
The only patient. And I have ALS on standby, and he's already sitting up, so spinal immobilization or spinal precautions might not be necessary right now, but we'll further evaluate that during the examination. So I'm gonna, as I go through this, as I do the assessment and ask questions, I'm gonna be doing the assessment head to toe, so I can go a little bit faster. Hey, sir, how you doing? I'm John. With EMS Services. What was your name?
John.
John. Hey, do you mind if I ask you a few questions and take your vital signs?
Go ahead.
All right. So, we got his name already. What brings us out today?
So I was in the batter's box getting ready to hit. He threw the 90-mile-per-hour fastball, and it struck me on the left side of my chest.
Okay. Do you know where you're at right now?
The baseball field.
The baseball fields, and do you know what day of the week it is?
Sunday.
Sunday. So he's alert and oriented times 4. I've checked his airways open. I've checked his pulse and his respirations and his skin color.
Airways open and patent. His breaths are 24 breaths a minute, shallow and diminished. Lung sounds on the left are diminished.
Okay. What was his skin like?
His skin is warm pink and diaphoretic.
Okay. So, we're going to go ahead and put him on a non-rebreather mask with 15 liters of oxygen. We're going to continue on with the assessment. So, I'm going to check him head to toe right now. Hey, sir, I've got my pin light here. Can you look into the pin light? So don't move your head, just move your eyes. Can you cover an eye for me? Sure. And go right, take it off. So is there any decap BTLS to his head?
No.
And his eyes are good? Pearl?
Yes, his eyes are pearl.
Okay, and so do you have any, so we talked about the signs and symptoms. Do you have any allergies?
No.
Do you have
Actually, yes.
penicillin? And are you on any medications currently?
No.
Okay. And when's the last time you ate?
2 hours ago.
2 hours ago. All right. Do you have any past medical history, a history of chest problems or trauma, or any past pertinent medical history? Okay. And we already talked about the events that led up to this. So does he have any jugular vein distension or tracheal deviation?
No JVD or tracheal.
And we've had him take his shirt off, and we've checked his chest and listened to his breathing sounds, which you already said.
His breaths are shallow and diminished. Lung sounds are shallow on the left.
Okay. And was there any decap PTLS to his chest?
Bruising and tenderness over the left ribs.
Okay. And so we're going to check his upper extremities, and we're checking for radial pulse and PMS.
No injuries noted.
And is there any PMS to his distal?
PMS is present.
Okay. We're going to check his abdomen for decap ETLS distension. Is there any decap ETLS?
No injuries noted.
We're checking his hips and lower extremities for PMS and his distal radial or his distal pulse or his PMS
PMS is present in lower extremities.
Okay. Can you stand up for me, sir? All right. So we're checking head to toe here for any decap ETLS.
No injuries noted.
Sure. Okay. And so my field impression of this is we got a 22-year-old male patient who's possibly going into shock. He's having respiratory issues breathing, might have bruising to his heart or broken ribs. I don't have noticed anything They don't indicate a flail segment yet, but he is having some breathing problems. So we're going to transport immediately, and we're going to reassess him every 5 minutes.
His blood pressure is 95/60. Pulse is 122 beats a minute. Respirations are 24 breaths a minute and shallow.
Okay. All right, so we're going to maintain oxygen, continue to reassess and transport. That's it.